Today we're diving deep into a topic that's both important and unfortunately still misunderstood by many: HIV, or Human Immunodeficiency Virus. We'll talk about what HIV is, how it affects the body, and most importantly we'll focus on how treatment has completely transformed the outlook for people living with HIV. We'll also cover PrEP, which stands for Pre-Exposure Prophylaxis, an incredible tool that can prevent HIV in the first place. Whether you're living with HIV, supporting someone who is, or just curious about the topic, you're in the right place. Let's get started. HIV is a virus that targets and weakens the immune system, particularly a type of white blood cell called CD4 cells or T helper cells. These cells are essential for fighting off infections. Without treatment, HIV can gradually destroy the immune system, making it harder for the body to fight off even minor infections. If left untreated, HIV can progress to AIDS, or Acquired Immunodeficiency Syndrome, the most advanced stage of the infection. At this point, the immune system is so weakened that a person becomes vulnerable to a wide range of opportunistic infections and certain cancers. However, thanks to modern treatments, very few people in countries with access to care actually progress to AIDS anymore. Today, HIV is considered a manageable chronic condition rather than a death sentence. With proper treatment and care, people with HIV can live long, healthy, and fulfilling lives. The cornerstone of HIV treatment is antiretroviral therapy, commonly known as ART. ART involves taking a combination of medications that target different stages of the HIV life cycle. By doing this, ART prevents the virus from multiplying and reduces the amount of HIV in the blood, what doctors refer to as the viral load, to undetectable levels. When a person's viral load is undetectable, not only is their immune system protected, but they also cannot transmit the virus sexually to others. This is often summed up with the phrase undetectable equals untransmittable, or U equals U. It's an empowering message that underscores how effective modern HIV treatment can be. Let's talk a bit about the different classes of ART medications. While the names can sound intimidating, like integrase inhibitors, protease inhibitors, nucleoside reverse transcriptase inhibitors, and non-nucleoside reverse transcriptase inhibitors, what's important to remember is that these drugs work together to suppress the virus. Most people today start on a regimen that combines 2 or 3 of these classes into a single daily pill, making it easier to stick to treatment. Starting ART as soon as possible after an HIV diagnosis is recommended by experts worldwide. Research shows that early treatment not only helps preserve immune function, but also reduces the risk of transmitting the virus to others. Some people may feel overwhelmed after an HIV diagnosis, but it's essential to know that effective treatment is available and that support exists to help navigate the process. Now, let's address what it's like to actually be on treatment. Many people living with HIV worry about side effects, and while some side effects can occur, like nausea, headache, or fatigue, they're often mild and temporary. Modern HIV medications are far safer and easier to tolerate than those from the early days of the epidemic. Most people on ART can continue with their usual routines, including work, exercise, and social activities. It's also important to keep in regular contact with your doctor to monitor your health, check your viral load, and ensure that your treatment continues to work effectively. One of the most empowering aspects of treatment is reaching an undetectable viral load. This means the amount of HIV in your blood is so low that standard tests can't detect it. Achieving and maintaining an undetectable viral load is the goal of ART, and it's associated with better overall health and a longer life expectancy. It also means that you can't transmit HIV to your sexual partners, which is a major breakthrough in HIV prevention and a huge step forward in reducing stigma. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, let's now talk about PrEP, or pre-exposure prophylaxis. PrEP is a daily pill, or in some cases an injectable medication, that can prevent HIV infection in people who are at risk. PrEP is highly effective when taken consistently and can reduce the risk of getting HIV from sex by more than 99%. PrEP is recommended for people who don't have HIV but may be at higher risk of getting it. This might include individuals with an HIV-positive partner, people who have multiple sexual partners without consistent condom use, or people who inject drugs. PrEP can be a game changer, allowing people to take control of their health and significantly lower their risk of HIV infection. If you're considering PrEP, it's important to talk to your healthcare provider. They can help you understand whether PrEP is right for you, how to start, and how to monitor your health while taking it. Regular checkups and HIV testing are essential when on PrEP to ensure that if HIV is acquired, although rare, it's detected early and treated promptly. Let's briefly talk about post-exposure prophylaxis, or PEP. This is a different approach that involves taking HIV medication after a possible exposure, such as unprotected sex with someone who may be HIV positive or sharing injection equipment. PEP must be started within 72 hours of exposure and taken for 28 days. It's an emergency measure, and if you think you've been exposed to HIV, seek medical care right away. So where does all this leave us? HIV is no longer a death sentence. With effective treatment, people with HIV can live full, healthy lives. And with prevention tools like PrEP and PEP, along with consistent use of condoms and other safe practices, the risk of acquiring HIV can be drastically reduced. But treatment and prevention aren't just about taking pills. They're also about mental health, relationships, and community support. Many people living with HIV face stigma and discrimination, which can make it harder to seek care or talk about their diagnosis. That's why it's so important to have open conversations like the one we're having today. If you're living with HIV, remember you're not alone. There are countless support groups, counselors, and healthcare providers who can help you navigate the journey. The most important step you can take is to start treatment and stay engaged in your healthcare. By doing this, you can live a long, fulfilling life. Before we wrap up, I want to emphasize that HIV is a medical condition, just like diabetes or high blood pressure, that can be managed with the right care. We've come a long way since the early days of the epidemic. The advances in science and medicine mean that HIV doesn't have to define you or limit your future. If you're interested in learning more about HIV treatment, prevention, and support resources, talk to your doctor or reach out to your local health department. There are many resources available to help you stay informed and empowered. Thank you for watching. As always, take care of yourself and make the most of your day.